Okay, your doctor told you have chlamydia. Now what? Are you freaking out because you're worried you might be infertile, or you have to contact that partner who you just can't stand anymore and like tell him or her, like, what is going on? I got you today. Hey everyone, welcome back. I'm Dr. Jennifer Lincoln, board certified OBGYN, author and educator, and welcome to the health class you didn't get in high school. And this one's an important one because if you're watching this because you have chlamydia, here's the bad news. You have a sexually transmitted infection. It came from someone. It did not come from a toilet seat. Let me repeat, it did not come from a toilet seat. And I'm going to say that again a little bit later on. But good news, it can be so easily treated. And having chlamydia or any STI is not a reason for shame because, as you'll learn, they're super common. And good for you for wanting to get information on how to treat it, prevent it, talk to a partner. That's what we're doing today. Before I dive in anymore, go ahead and like, subscribe, turn on the bell so you never miss an upload. So what is chlamydia? Well, it's the most common sexually transmitted infection that's reportable in the United States. As you can see in this image here, in 2022, there were 1.6 million cases of chlamydia. So you are in very good company, my friend. It is caused by the cute little bacteria that you see here called Chlamydia trachomatis, which is why we just say chlamydia. It's spread by the things you probably have heard of, like vaginal sex, anal sex, but it can also be spread by oral sex and the sharing of toys. So while we often think that sharing is caring, when it comes to your toys, that's not one of them. And I will say it again, no, it is not spread by a toilet seat. No matter how many times your partner wants you to think that's true, it's not, because it can't live outside the body like that. So chlamydia can affect the vagina. It can affect the reproductive organs, so it can go up into the cervix and the uterus and the fallopian tubes. It can infect the rectum, the mouth, the urethra, or the tube where the pee comes out. It can even affect the eyes. We see this in babies who are born vaginally to mothers who have active chlamydia. What are the symptoms of chlamydia? Unfortunately, one of the most common symptoms is no symptoms, which is why so many people get it. But if you do have symptoms, you'll commonly have discharge that doesn't seem right. It may be burning. You may have burning when you pee. If you've got a uterus, you may notice spotting that isn't when you normally would expect it during your period. Or you could have abdominal pain, especially if it's gone up into the uterus and it's caused something called pelvic inflammatory disease, or PID, which we'll talk about a little bit. Actually, I'll talk about it right now because one of the long-term complications of chlamydia is PID, again, pelvic inflammatory disease. About 1 million people every year in the United States get diagnosed with this. So it's when chlamydia or other bacteria, it's not just caused by chlamydia, but it's when the bacteria works its way up from the vagina into the cervix and the uterus and into the tubes, and it can cause scarring there. A question I often get from people is, well, how quickly can chlamydia go from just chlamydia to pelvic inflammatory disease? And unfortunately, it can happen kind of quickly, from days to weeks after having it and not being treated. 1 in 10 people who have PID will have infertility from it because the fallopian tubes are all scarred because of the chlamydia or the infection in the tubes. So it's serious. People who have PID also have a higher rate of ectopic pregnancies, so a pregnancy in the tubes or that doesn't make it down into the uterus where it should be, and that's because the pathways through the tubes are not as clear because of that scarring. And it can also lead to chronic pelvic pain because of scar tissue that builds up in the pelvis and the abdomen. Okay, but let's be optimistic and talk about treatment. And the good news is that treatment is super simple. The most common treatment is the antibiotic doxycycline, and it's pills that you take twice a day for 7 days. If you are allergic to doxycycline or you're pregnant, there are other antibiotics that you can take. I often get asked if you need to be tested after you take the antibiotics to make sure that it goes away. And we really only recommend it in people who are pregnant. We recommend a test of cure, that's what it's called, 4 weeks afterwards. And that's because, number 1, you're pregnant. Sometimes things don't get treated as well. And number 2, we want to make sure you're fully treated for when you do give birth, that chlamydia still isn't active in the birth canal and could affect your baby's eyes or their mouths. Okay, what about what you can do while you're getting treated? Number 1, please don't have sex while you're getting treated. Wait until treatment is complete. And number 2, your partner needs to be treated too. Otherwise, it's just going to keep going back and forth if you're still sexually active. In an ideal world, your partner will go in and get tested, not just for chlamydia, which we will assume that they have if they're having sex with you, but for everything else as well, because it's good just to make sure we check a full panel if you've been diagnosed with one sexually transmitted infection. However, it's not required, and there's something called EPT, which is expedited partner treatment or expedited partner therapy, and that's where somebody like me, who's an OBGYN, If I write you antibiotics, I can also write them for your partner, whether they're male or female, without having to actually see them or examine them. It's a public health initiative to get people treated and not make having them to go see a doctor or a provider be a barrier to them not getting treated. So lots of states do allow that, and you can look that up to confirm or just ask your healthcare provider. And then if it's not getting better after treatment, please be seen, because it could be PID. And if that's the case, you would need different antibiotics, either stronger ones, sometimes IV antibiotics to make sure it goes away. Okay, but what about the awkward question of, yeah, but that person's not my partner anymore, or I've had a few partners and do I have to tell all of them? The answer is, in an ideal world, yes. Otherwise, how do we ever get chlamydia from being one of the most common STIs to not being out there and so prevalent? So either you can tell them, or the state health department could contact them without mentioning you as the reason they're getting contacted. It is ideal to notify all partners that you've had within the past 60 days. I know it may seem awkward, but everybody has an STI status, right? You either have something or you don't. And it is one of the most mature adult things that you can do to talk to your partner and say, hey, I have this, you should get treated. Maybe you don't love them anymore. Maybe they did some terrible things, but we want to try and be adults here and not have these infections spread everywhere and then potentially hurt their next new partner, even if you don't like him or her. I know. Okay, we can't talk about chlamydia without talking about prevention. Yep, you don't want to get it again, and I totally hear you. So how do you make that happen? Well, knowing your status, if you have a new partner, recommending that you and them get tested ahead of time before you have sex, and using protection like condoms or dental dams to prevent that transmission. And don't share your toys. Share other things, but don't share those. Share your love. Share your hopes and dreams. Share a cookie, or don't. I don't like sharing my desserts, but don't share your toys. Okay, last thing, what do you need to know if you've had chlamydia before? Number 1, keep an eye out for those PID symptoms. Number 2, know that if you have it, you are not a bad person, you are not dirty, you are not gross. You are a human who's had sex and you got chlamydia. Big deal. It's okay. Anybody in the comment section who's trying to shame you or make you feel bad for it, screw them. They're not worth it. Number 3, if you have any pelvic pain issues, or you're dealing with infertility, or you're trying to get pregnant and you're not able to, make sure your healthcare provider knows this, because this could affect how we diagnose you and treat you. And number 4, if you've had a diagnosis of PID before, definitely let your healthcare provider know, so that if you do have a positive pregnancy test, or you're trying to get pregnant and you can't, we can monitor you for things like infertility, or if you are pregnant, make sure you don't have an ectopic pregnancy or a pregnancy outside the uterus. And I'm going to say it again, there is no shame in the STI game. It happens, even to people who use protection, because things aren't perfect. So spread the message. Chlamydia, super common. Spread the message, don't spread chlamydia. I like that. That could be the new public health, the new public health advertisement right there. So get it out there. Know that you're not dirty. You're not a bad person. It's super easily treatable. And I have lots of excellent references and resources that the average person can look at and read about, and you can share and feel really informed and empowered. As always, drop your questions and comments in the comment section below. Follow me on my other social channels for updates all throughout the week. And stay safe, stay protected, and stay shame-free out there, my friends. Bye-bye.